Being a black gay male and becoming pos, being ridiculed by your family, being ridiculed by your church family, even being ridiculed by some of your friends that you thought you had. I didn't want anyone my age and younger to go through that and to feel like just because you're pos, everyone's going to look at you differently. Everyone's going to treat you differently. As a pos person, I never felt judged coming here. I never felt like I was being demoralized in any kind of way.
So CRUSH is a 4-year demonstration study which is funded by the California HIV/AIDS Research Project. The focus is to provide comprehensive sexual health services to a population of young gay men in an environment where there aren't readily available services here in Alameda County.
What I really like about CRUSH is the fact that they pay attention to MSM as a behavior and not an identity. You don't really have to be gay identified to come to CRUSH. You just have to exhibit that behavior because some people don't have labels. I think if we had more clinics that actually looked at a behavior and didn't put you in a box, you would actually have more people coming in and taking advantage of the services that are offered as well.
We really try to encourage our participants to come in and make educated and well-advised decisions on how they want to pursue their sexual health. PrEP is a part of a package of services, and it's part of a toolkit that young men have options to choose what is the best way for them to practice their HIV prevention methodologies. Community input in this work is mandatory. We need the entire community at large who is impacting and working in HIV to say, hey, these are services that we need. This is a population that we need to work with, and so who do we need to have at the table in order to make sure that we're having the greatest impact? San Francisco, as you know, is historically very well tuned to being able to provide services and access for gay men around HIV and sexual health. And I think Alameda County is very different. It's the area that has the city of Oakland, which is one of the most diverse cities in the United States. And it also is a city that really struggles with finding economic balance. We don't have a clinic here in the same way that San Francisco does that offers those sorts of routine services. There isn't sort of a standalone clinic. Services are really spread out and concentrated primarily within the hospital settings, whether or not they're the public or private hospital settings. So that means there isn't a place that provides that one-stop shop access to sexual health services for this population.
A lot of people think of the Bay as this amazing area that's diverse and accepting, and I think that while all those things are true, it's still a tough community and people face their own significant issues in this area, and being able to learn what young people are going through in this area and be able to provide services for them and access to health care where they might not get it otherwise is really exciting.
As a disenfranchised people, we don't have resources. So for black men who are MSM, that stigma is also there, culturally as well. For a black MSM, am I comfortable going to get care? Am I comfortable going to seek help? Am I going to run into somebody that I know? Is my family going to find out certain aspects of my life? Again, we are a culture of people that are constantly trying to build our own self-value and our own self-worth because it wasn't offered to us.
The CAB is our front line in terms of reaching the population that we're serving. They know where folks are, they know who they are, they know how we need to speak to them, they know what they need to hear, and they know how to deliver those messages. We consider them our ambassadors.
The CAB is important because you're taking a generation of people and you're giving them a voice. And that voice is basically stating what the needs are within that community.
Youth programming within clinical structures needs to be really flexible. And so one of the ways that CRUSH works to address that is that we sort of have this idea of a clinic without walls, meaning that young people don't have to go through the same routine sort of registration processes that the adult population goes to. There's a separate area of the clinic where they walk into, they register, and they go right back into the clinic. So the idea that we need to have flexible sort of clinical structures to allow for young people to sort of flow easily in and out of care is very important.
The way the clinic is set up, it makes you feel really comfortable.
You can schedule an appointment through a text message. For a lot of people, I feel like this de-escalates the impact it has on someone in terms of the struggle to actually want to go in and get tested.
You get a sense that they care about you as a person. And I feel like that's important, especially when it comes to you're in here taking a test, you're already feeling kind of apprehensive about that. And it's not just a stern person with gloves about to poke and prod you and that's it, and send you on your way without no dinner or anything.
When we started this project, we had no idea how it was going to go. We did a lot of work to actually engage men about their sexual health and engage them about things that make them happy sexually in their relationships. But I think the big lesson that learned from this is that the best way to bring men into these services, and young Black men in particular, is to build comprehensive services, build them in a very thoughtful manner that appreciates who they are, and to allow them to know that it's a safe space, and they will come and their friends will come.